The case of today for a lady 30 years old. She was complaining of chronic abdominal pain. CT was done, revealing. These are some images from the CT study done for the patient with intravenous contrast administration. Unremarkable solid abdominal organs, spleen and both kidneys, pancreas, all of the solid abdominal organs are unremarkable. When we come down to the region of the lower abdomen, here we can appreciate multiple small bowel loops showing marked thickening. Here in this region, giving the appearance of target lesion or halo sign, marked enhancement of the mucosa, non-enhancement of the submucosa, and mild enhancement of the serosal layer. This is the target sign. So this is the small bowel loops, marked thickened, as well as marked enhancement of the mucosa. The distribution of the disease involving here the region of the terminal ileum. So this is the cecum here, this is the terminal ileum. Terminal ileum showing marked thickening and marked also mucosal enhancement, in addition to involvement of the adjacent cecum and the proximal part of the ascending colon. So the ascending colon is involved, cecum is involved, and the terminal ileum is involved, in addition to multiple loops of the distal ileum. We can appreciate also multiple mesenteric lymph nodes enlargement. This is one of the lymph node enlargement in the mesentery of small bowel loops. Another one. So we have multiple mesenteric lymph nodes enlargement, in addition to engorgement of the mesenteric vessels in between the bowel loops. So what do you see here? This is engorgement of the mesenteric vessels, as well as creeping of fat. What is the meaning of creeping of fat? Creeping of fat means a mass of mesenteric fat encircling the bowel loops. In the coronary reconstruction image, we can appreciate again this is the terminal ileum, giving the appearance of target lesion or halo sign, marked enhancement of the mucosa, non-enhancement of the submucosa, and mild enhancement of the serosal layer. This is the target sign. Terminal ileum is involved, in addition to the cecum. See how much of the mucosal enhancement of the cecum here, as well as the proximal part of the ascending colon up to here. The small bowel, the distal small bowel loops are thickened, enhanced mucosa also. This is the creeping of fat, as you see here, with engorgement of the mesenteric vessels. Again, you can appreciate multiple mesenteric lymph nodes enlargement here. Very important feature of the disease we can appreciate in this image here. What is this here? This is flattening of the mesenteric border of the involved small bowel loop. Again, flattening of the mesenteric border of the involved small bowel loop. And in the anti-mesenteric side, we have multiple sacculation. Very clear. Flattening and smooth outline of the mesenteric border of the involved bowel loop, and in the anti-mesenteric border we have multiple sacculation. This is one of the characteristic feature of this disease. So these features are highly suggestive of Crohn's disease. So what is Crohn's disease? Crohn's disease is one of the idiopathic inflammatory bowel disease, usually affecting the female more than male, and usually affecting the young age group. The radiological features of all inflammatory bowel disease, I mean Crohn's disease or ulcerative colitis or Behçet disease, and all the infectious bowel disease, and all the ischemic bowel diseases, and even the post-radiation bowel disease, all of these diseases of the bowel, its radiological features in the CT more or less the same, affecting the bowel in the form of what? Marked thickening of the wall. Crohn's disease, marked thickening of the wall. Ulcerative colitis, marked thickening of the wall, and. So how can we differentiate between all of these entities? We can differentiate by pattern of involvement and the distribution of the disease itself. So regarding our case today, Crohn's disease, it has a specific distribution. 85% of Crohn's disease involving the terminal ileum, 14% involving the colon alone, and 1% involving the small bowel alone without involvement of the terminal ileum. From the 85% which involving the terminal ileum, 50% involving the colon, and the 35% involving the small bowel. So we have 50% involving the colon and the terminal ileum, and 35% involving the small bowel and the terminal ileum, 14% involving the colon alone, and 1% involving the small bowel alone. So this is everything about our case today, case of Crohn's disease. Thank you.